Hello, welcome to my frequently asked questions. A common question that I get asked is how do I get rid of my turkey neck? And so in a way, this is a subject that has, well, quite a few intricacies. And so what do we need to talk about? Well, first of all, what is a turkey neck? What makes a turkey neck? And then how can we go about treating it? And what are the treatment options? Are there non-surgical options? What are the surgical options? And then in terms of these options, well, what is the recovery from treatment? What are the potential downsides or risks of treatment? And then what I will do is I'll take you through a number of different cases, like a number of different people's necks, different shapes, different sizes, and what are the treatment options for these different appearances. And then finally, a few of my top tips. So, first of all, my name is Dr. Julian Silva. I work in London in Harley Street and I specialize in only facial, cosmetic and plastic surgery. I specialize in three main procedures: face and neck lift surgery, blepharoplasty and rhinoplasty. I have fellowships from both London and overseas in Los Angeles and New York. And this is what I do every day in, day out. So in terms of medical disclaimer, well, in a way, this is only for information and educational services, and no video can ever can't be construed as a consultation and give you advice. You really need to see a clinician and surgeon in order to be able to do that. So first of all, well, what is a turkey neck? What makes up this area of the neck? So with aging, the three common aspects are, well, we lose some elasticity in our skin, we have weakness in the muscles, and there is loss of volume. And in the neck, what this results in is loose skin that we can see, banding in the neck, which is often related to the underlying muscle, the platysma muscle, and we have loss of volume. There are of course other factors that can also have influence, and genetics can play like a significant role with this. And for example, if you're very flexible, you can bend your fingers way back. Well, your hypermobility means that the way that you're made, the genes that you've inherited from your parents, well, that gives you a lot more bending of and flexibility in the skin, which often gives you more loose skin around the neck and the jawline. And unfortunately, that cannot be helpful. And then, of course, other factors. In women, it could be the menopause and often the hormonal changes that go on at this time, the drop in estrogen and progesterone. Well, these changes in hormones can also add to the aging effect. And in men, well, another factor can be loss of weight. If you've lost a lot of weight, well, often this can result in more laxity in the neck area. And these are just a few of some of the factors that can influence this area. Well, what does it actually show us? Well, in terms of the neck, we often have laxity, we often have loose skin, we often have bands. There's also the effect of gravity, everything is always coming down. And every year we lose a little bit of our natural fat, our natural volume. And all of these things come with gravity into the neck. And these bands that we often see, which are described as a turkey neck, well, although you see them as loose skin, it's more than just loose skin. It's often this muscle, this sheet of muscle that in your 20s is kind of like a light, tight elastic sheet. Well, it gets looser with time and you start to see bands in this platysma muscle. So how can we get rid of it? Can we do it non-surgically, or are we going to need surgical options? Well, what are our non-surgical options? Well, really, Botox is the first line, and Botox reduces movement where it's injected. And there is a concept called the Necklift lift, where Botox can be injected into the platysma muscle in the neck, and it reduces the movement in that neck muscle, which can improve the appearance of the neck. And so certainly this can be of benefit in patients if you have quite early changes, but it really doesn't help if there's loose skin, because it won't do anything to tighten that loose skin. Fillers, Well, fillers can definitely have a role because, as we talked about, you lose some volume every year with natural aging, and if you do a lot of exercise or you're very fit, it can exaggerate that. And loss of volume, well, it can be replaced non-surgically with fillers. However, there's a limit to how much fillers you really want to add in the lower third of your face, because adding more volume and more fillers here, well, it can give a squarer appearance to your jawline, which definitely is not more youthful. Because when you're young, you tend to have a more V-shaped jawline, and then with time and gravity it becomes squarer, and if a lot of volume is added to that square jawline, it just makes it squarer. Threads, well, thread lifting has a role, but really the main disadvantage is it's only very temporary. It only lasts for a period of months, and so it can be a limited effect if you're looking for something that's going to last anything more than very short term. And then there are devices that can be used on the neck, and the devices can use radio frequency, ultrasound, heat therapy. All of these devices work on tightening the superficial layers of the neck. So they will have a role in tightening small amounts, millimeters of loose skin. The main challenge is, well, often patients have more than a few millimeters of loose skin, and often if you've got more than a centimeter, well, unfortunately I see many patients who are disappointed because they've had non-surgical treatments that haven't made a real difference. And so there is a point where really the non-surgical treatments don't offer enough of an improvement in this specific area. So then, well, if you really have more changes and more of a turkey neck, really you need to have like a surgical procedure to really improve that. And in terms of surgery, well, what can be done differently to non-surgical is that areas can be lifted, areas can be tightened, the kind of youthful and natural V-shaped jawline can be recreated by lifting. And often you can see like fairly immediate changes in the jawline. In my patients, less than 24 hours after surgery, you can see an improved neck, an absence of a turkey neck, an improved jawline. However, there's always a bit more swelling and recovery with any kind of surgical procedure. So then, in terms of improving the neck, well, we had a look at the anatomy, and in this area you have like the platysma muscle and you have loose skin. But the other important consideration is gravity and the effects of aging. Well, it affects your entire face, so everything is coming down with gravity. And in a way, although the focus can be on your neck, that can be what you see in the mirror, often to get the best rejuvenation and look more youthful, you really need to lift above the jawline. You need to lift the parts of the face that have dropped with gravity. And that often means incorporating facelift surgery with a neck lift procedure. As you can see in this patient, well, there's a lot of changes in this lady's neck, and there's a lot of laxity of the skin, there's a lot of changes in the platysma muscle, and this is classical like kind of turkey neck. But there's also a descent here. There's like jowls, there's loss of the jawline, and really I improved this lady's neck by lifting this part of her face, and that's what's given her not only like an improved angle in her neck, but it's lifted this area upwards, giving her a more youthful jawline. And this is a really important consideration with neck lift surgery. You really have to look at the face as a whole, because a proportion of patients, well, you're really going to need a facelift and a neck lift procedure to get the very best results. And the reason is because this area of the face really drops down with gravity, and so we really need to lift this up in order to improve the areas of the neck. In contrast, this area behind the blue line, well, this doesn't really change very much, so it's only this area that drops with gravity. And by lifting this area up, well, that's what gives you the more V-shaped, youthful jawline. So with a neck lift procedure, what is the kind of recovery involved? Well, generally, facelift and neck lift surgery, it's a surgery that really takes like 3.5 to 5.5 hours, depending on exactly what is required. And part of that, the main part of recovery and healing is swelling. And swelling really takes a period of weeks to completely vanish. On average, 80% of swelling goes between 2 and 6 weeks, and generally I recommend most of my patients have 2 to 3 weeks where they can avoid seeing people professionally and socially, just to give them good time to recover. Now, all recovery is variable, and some patients can look really good even a week after surgery. However, generally when it comes to surgery, it's worth being conservative and allowing extra time. And that's why I advise my patients to have a bit more time, just in case they have a bit more swelling. Now, there are things that can be done to improve healing and improve recovery. And these include the use of sedation anesthesia, which tends to give you less bruising and swelling, the use of oxygen, like hyperbaric oxygen, that can aid recovery, and other techniques such as lymphatic drainage that can help reduce the swelling faster. And on the more cutting edge of our understanding, the use of regenerative medicine can also be used in this way. What are the potential risks? Well, with any kind of surgical procedure, there is always some element of risk. And the most common things are swelling, and sometimes patients will have a bit more swelling, and it takes more time for the swelling to go down. And often this means being conservative in terms of allowing time where you've got to recover, where you haven't got to see people socially or professionally. Often bruising will go within 2 weeks, but rarely you can have a bruise even for like as long as 6 weeks. But that of course can be covered with concealer. Expectations are absolutely important because patients with thinner skin, well, thin skin is very unforgiving. Even the tiniest imperfection can be seen in the neck area. And patients with very thin skin, well, it's very difficult to give like a result that is completely smooth as glass, because the thin skin will always show your underlying anatomy. And often the underlying anatomy, well, there's fat, there's muscles, there's salivary glands, and so it's never like 100% smooth. The other element of expectations is patients have really lax skin. Well, if you have really lax skin, like more than 3-4 centimeters of loose skin, well, with any surgical result, you want to edge on the side of being conservative, and some of those patients will require a little bit more touch-up surgery at a year when everything is settled, because they have such a significant amount of skin laxity. Serious issues? Well, occasionally, 1 to 2% of the time, there can be stretching of a motor nerve, and that can be frustrating because although it will completely recover, rather than recovering over a period of weeks, it takes a period of months to recover. And unfortunately, these things do occasionally occur. Skin necrosis, well, that's where rather than skin healing as a nice fine line that is difficult to see, the scar, well, that's where an area of skin is much slower to heal. And that is really associated with smoking. But there are treatments that can be used to counteract that, such as the use of hyperbaric oxygen can heal the body faster. There are, of course, other issues that are listed on any kind of consent form, such as infection, longer recovery, and generally speaking, those things are quite rare. Overall, a face necklift surgery, well, generally patients have a pretty smooth recovery and fast healing, but as with anything in life, sometimes you have a longer recovery and just things take a little bit longer to heal. So let's have a look at a few specific cases of patients with necks and different shapes of necks, and have a look and see what gave them the best result. So a classical neck lift would be a patient such as this, where there's absolutely changes in her neck, there's laxity, there's loose skin, there's no real kind of jawline, and there's also been some volume loss. Now really, what's going to give this patient the best result is a combination of a neck lift and a facelift procedure, and combining these two together will give a superior result. Now this patient, well, has a fuller neck, and this lady, well, when she came to see me, she described a fuller neck even in her 20s and 30s. Now this kind of change in the neck is also a result of genetics, and often it means that there's some deeper fat in the neck, and often the salivary gland, rather than being tucked up under the jawline, just sits lower down in the neck. And what that means is, to give the very best result, like as this patient shows, often you need to shave some of that deeper fat and shave down the very lower part of the salivary gland in order to give the best result. Now, the advantage of doing this is, well, you get a much better defined neck, and often those patients have a better neck than they had even in their 20s and 30s. The disadvantage is often you have a bit more swelling, and there's a bit more recovery time associated with this. Now, this is a classical male neck, and in this patient, well, we can see a lot of laxity in the skin, there's loss of the jawline, and really this patient benefited from a combination of a necklift procedure to tighten all the areas of the neck and a facelift procedure. Now, the important considerations in a man compared to a woman, well, the scars need to be very discreet, because often men will have short hair, and so there's much less room for like hiding scars. And so the scars can be hidden around the curves of the ear and back behind the ear in order to make the scars discreet. And the other consideration is beard growth, because if you have 2 to 3 centimeters of loose skin, such as this gentleman, well, if that skin is taken away, your beard growth can be moved towards your ear. And so these are very important considerations with face and neck lift surgery. And so although face and neck lift surgery can be done in 2 hours or less, really to hide the scars, to take care of things like the beard growth and scars, often these procedures take more than 5 hours. So the next case we're looking at is a patient with milder changes. So this would be a patient maybe in their 40s or late 30s, and so there's a small change in the neck. Well, they don't need the same level of neck surgery that we've previously been looking at. But an important consideration in these patients is really to lift the face upwards, because with aging, your face goes from being a more V-shaped shape to being squarer. So key in these patients, although the changes in the neck may be mild, is to lift upwards in order to restore a more youthful look. And often this can make a patient look more than 10 years younger just by improving the V-shape of their face. And finally, well, we have patients, generally these are going to be men, who have smaller changes in the neck, who are more suitable for a direct neck lift. And what this means is that there are no incisions or scars around the ears at all. All the surgery is completed in the neck area, and the scars can be hidden in where the beard growth lies. So in this patient, we can see there's a bit of tiredness in the neck area, and then afterwards it's just this sharper angle in the jawline. Now it means that afterwards there is a scar that's hidden in the beard growth, and this is at about 6 weeks, so we can see the scar is a little bit pink. However, with time, that pinkness disappears and the scar can be virtually invisible to see. And now this may be useful, particularly for men who may have milder changes, who have lost hair, and so the scars can be hidden underneath the chin area. So finally, what are my tips in terms of signature neck lift techniques? Well, it very much needs to be customized to your individual needs. And I've provided you a guide here on different treatments, but it very much needs to be governed by the changes that you individually have. Now, patients with milder changes, they may be suitable for the non-surgical treatments that we discussed, and sometimes younger people can also be treated quite effectively with a combination of a chin implant and a neck tightening procedure. And that might be neck tightening stitches that tighten the platysma with or without radiofrequency to tighten the skin. Mild changes in the neck, well, often like mini techniques, mini facelift surgery can really improve the appearance of the neck area and lift the face, giving a more V-shaped and youthful natural face. Classical changes in the neck and a turkey neck appearance, well, really these patients are going to benefit from a neck lift procedure and a facelift procedure in order to give the very best results. And then finally, additional procedures. Now, if you have a small chin, well, often augmenting the chin with a chin implant will give you a better proportions in the face and an improved cervical neck angle. That's the angle between your neck and your jawline. And some patients are going to benefit from reducing the fat in the lower third of their face, such as the buccal fat. So in summary, well, we really have talked through how to really look at a neck, how to look at a turkey neck, what makes up the turkey neck, what is the underlying anatomy, what procedures, whether non-surgical or surgical, can be used to help treat it. In terms of surgery, well, what are the different options in terms of surgery? What are the potential risks and recovery? And I've also given you some of my top tips on what will give you the best result. In terms of finding out what is the best neck lift for you, well, really you need to do some research. You need to see at least one or more surgeons, ideally specializing in the face and doing face and neck lift surgery every day. Unfortunately, there's no quick solution. Often you need to see someone who's going to give you the best guidance. I hope that this information has been useful for you. If you have any other questions or you'd like to my help in any further way, please do not hesitate to contact me.